In April, there was a significant breakthrough in the development of a vaccine, which has long been considered the Holy Grail of medical science. This, though, is not to do with COVID. It's about malaria. And it's about why international focus on one deadly disease has shone a light on the successes and shortcomings of our fight against another. Malaria infects around 250 million people every year and is responsible for at least 400,000 deaths. Most are children under the age of 5. The new vaccine was invented by scientists at Oxford University's Jenner Institute, which, by the way, is the same institute behind the incredibly successful AstraZeneca COVID jab, and it showed an efficacy of 77% in a trial involving 450 children. It is the first malaria vaccine ever to meet the goal of 75% set by the World Health Organization. So what does that mean? Well, its developers say when fully deployed, it could reduce those 400,000 annual deaths to the tens of thousands. It is then without doubt a potential game changer. But when COVID has shown us just how quickly and effectively the world can produce vaccines on a mass scale, why has the malaria vaccine taken so long to develop, more than 100 years in fact, and why won't it be deployed in the real world until at least 2024? For this, there are two key reasons. One is scientific, the other is to do with our priorities. Let's start with the science. The malaria parasite has been with us for tens of thousands of years, and as a result, it has had a very long time to find ways of infecting us. And crucially, it's developed a knack of evading or even tricking immune systems by changing its genes, effectively shape-shifting. Now, by comparison, coronaviruses tend to be more simple, stable and slow to evolve. They have also been the subject of vaccination research for decades, and this provided a solid foundation for scientists tackling SARS-CoV-2, the coronavirus that causes COVID-19. Yet while it's fair to say COVID vaccines didn't spring from nowhere overnight, they did make an extraordinary leap in very little time. And this brings us on to our second point, priorities, which reveals some uncomfortable truths. COVID-19 became a global pandemic. Wealthy economies were as affected as any other. In contrast, at least 92% of malaria cases occur in sub-Saharan Africa. These are countries without the resources to pay for expensive vaccine research and development. Instead, they rely on global funding, that is, from nations whom malaria isn't a top priority. It's estimated that since 2007, the total spent on developing malaria vaccines is around $2 billion. Meanwhile, one US data firm predicts that by 2025, worldwide spending on COVID-19 vaccines will exceed $150 billion.
That means big and it means fast.
The biggest vaccination programme in British history.
Clearly, when wealthy nations are affected, the money can be found. Incidentally, the UK's contribution to malaria vaccines has been slashed by recent cuts to the foreign aid budget. But this global focus on fighting COVID-19 and the advances made during it should benefit the fight against malaria. First, some COVID vaccines, including Pfizer's and Moderna's, have been developed using RNA technology, and they have proven to be safe and effective in the real world. It's the same kind of technology that's used in Oxford's malaria vaccine. Second, we also now know the important process of trials and approvals can be sped up without compromising health and safety. Oxford is hoping its malaria jab can be given emergency authorisation in the way COVID jabs were. And third, the rapid and huge scale-up of production of COVID vaccines can be more easily replicated. And in some cases, factories can be adapted since the technology is so similar. Science has shown how it can rise to the challenge when given the tools it needs. But to achieve the same success at the same speed, malaria vaccines need the same level of commitment from governments around the world. The opportunity is there, but is the will?